everyone. My name is Matthew Lopez. Before I get on my main claim, I just want to introduce a very infamous character. His name is Martin Shkreli, and he was the guy that increased the price of his drug from $13.50 to $750. And ever since then, which I'm sure most of you guys think the same way, that big pharmaceutical companies have had a target on their back for their current drug prices. And this has been seen through politicians and as well as the American public. And what I'm here to tell you is what my major claim is, that current pharmaceutical drug prices are actually there to ensure the development of new drugs. And I'm going to support this through three secondary claims. First, that the current drug prices have little impact on our current healthcare bill. Second, that the cost of drug development is extremely risky and expensive. And lastly, that pharmaceutical companies are unable to rely on blockbuster drugs to fund their research. So going back to my first secondary claim, where it has little impact on our healthcare bill, Americans spend about $300 billion on pharmaceutical drugs every year, which sounds like an awful lot, but that only makes up 10% of our annual healthcare bill, which is half of what we spend on physicians and 1/3 of what we spend on hospital care. And also an added fact is that most private insurance, Medicare, and Medicaid cover prescription drugs. And lastly, drugs are usually more effective and cheaper than using alternative treatments. So developing these new drugs so we can use them and not spend money or time in the hospitals is extremely risky and expensive endeavor for a company. The cost of developing a prescription drug has been steadily increasing. In 2014, it was calculated to develop a market-approved drug, it cost $2.6 billion. As well as after it's been approved, you need to spend another $312 million after it's already been approved to gather more data and do a few more testing. And then lastly, approval of new drugs have been steadily decreasing. So 25% fewer drugs on average have been approved over the past decade. And according to Michael Hay, and his team of researchers who are industry professionals, and their whole job is to look at new drugs that are going into clinical trials and see what the likelihood of them being passed by the FDA are. And they found that 1 in 10 drugs that enter clinical trials are approved by the FDA. So that means that 9 out of these 10 drugs fail, which is extremely expensive. When a drug fails a clinical trial, which is part of the development process of forming a new drug, it can cost the company between $800 million to $1.4 billion, depending on which phase it fails in. And so lastly, going to my third point, that pharmaceutical companies are unable to rely on blockbuster drugs to fund this type of research. And so what a blockbuster drug is, it's a very popular drug that generates sales of at least $1 billion a year. And so profits of these drugs used to be able to fund research for next year's, but this is no longer the case. The market has been shifting to forming drugs for more targeted illnesses that do not have the same market as a blockbuster drugs. So according to Dr. Huss, who has been a cancer researcher as well as the chief medical officer of clinical trial companies, who's had 20 plus years experience in the field, says that with drugs now focusing on smaller patient populations, each drug has a smaller market in which to recuperate those R&D costs. This challenge is compounded by reimbursement issues as well as public and government pushback on high drug costs. So really, the prices that we set for these pharmaceutical drugs aren't there to gouge you for your money, which you could see that Martin Shkreli might have had the bright idea to do that, but it's really there so we can keep on formulating new drugs. So current drug prices are there to ensure development of new drugs. Thank you for your time.
And Matthew, structurally, everything I think is pretty solid. The proposition's clear. You've got a good preview for us. You signpost those points when you get to the body of the speech, except for the second point, which I know is the second point. I think I said this on the previous speaker because it's in the middle, as opposed to giving us a numerical signpost when you get to it. But you have a little bit of an explanation of each of the points as you go along. The clearest argument that you have concerns the cost that it takes to develop drugs. You've got a statistic, or you've got a number that says the average is $2.6 billion. We need a source citation on that. I don't doubt that you've got one. You just want to make sure that you give that information. And then the information that you present that suggests that 90% of the drugs fail during the testing process. You gave us a source citation on that, and that means that there's a potential cost of $800 million to $1.4 billion that comes, without any return on it. I think that's pretty solid. Now, the one thing, of course, that I think a response speaker is going to be thinking about is, well, what is the level of profit that these pharmaceutical companies have? How much revenue are they already bringing in? So if you've got a pharmaceutical company that's bringing in $200 billion, then it seems like the $800 million to $1.4 billion seems like a reasonable cost instead of an unreasonable cost. I do think you have a good explanation on the third point that suggests that because the focus has shifted from broader kind of issues to more narrow issues, it's more likely that we're going to run into difficulty in recouping our costs and that the prices will remain relatively high. I thought you had a pretty good explanation of that. So there is some citation of information, but it's not always consistent. The information that you did cite, I thought was pretty good on the success rates of the drugs. I thought that was pretty effective. I think we could probably use a little bit more context. I like the example that you used to get our attention, and I like the way you came back to it at the end of the speech to kind of remind us why we were having this discussion in the first place. All right, thank you.